Conflict's one of the biggest single ecosystem problems we now have for delivering health and cancer care. Something like 2 billion human beings now live around the globe in areas which are considered to be fragile or conflict affected. And we're seeing these very different forms of conflict driving deep inequalities in cancer care. We're seeing entire systems de-develop, for example, recently in Sudan, the complete destruction of what was a reasonably good healthcare system within Khartoum has been completely eradicated. We're seeing attacks against healthcare facilities and cancer care systems in Ukraine, and again causing huge displacement. So part and parcel of the problems of cancer is within conflict settings is simply attacks against healthcare facilities. The second major issue is changes in the way that patients move. During conflicts we see very large increases in internally displaced populations as they move from one area to another. We also see an increasing number of forcibly displaced human beings. So the refugee population now across the world is even larger than we saw after the end of Second World War. And these refugees have complex cancer care needs, and a lot of our cancer care systems are simply not set up to address this. Most cancer control planning is done on a national basis. We don't consider the cross-border movement of our patients, and whether you're looking at sub-Saharan Africa, Latin America, the Middle East, North Africa, even Southeast Asia, you're seeing patients move vast distance to access care because of conflict. And finally, when we're looking at the kind of conflict ecosystem in terms of the post-conflict world, we're also seeing huge challenges there. We see massive migration of healthcare professionals, many of whom never actually return to the country of conflict. So there's a requirement to almost have to rebuild conflict care from the beginning. We've been running a very large program for research for healthcare and conflict over the last 6 or 7 years, looking at both the sort of quantitative and the qualitative issues around delivering better cancer care for conflict populations. And the short answer is that there isn't one-size-fits-all solutions, that we need a much deeper understanding from the UN system, from individual countries dealing with forced displacement refugees, to build new cancer control programs for patients in conflict.